You've heard the excuses before. They're heavy, they're hot, they limit your field of view, and most of the time you ride without a helmet, things will turn out okay. But what happens when you crash and you're not wearing a helmet? My name is Mike, and I'm a motorcycle enthusiast and full-time doctor specializing in radiology, which means I look at x-rays, CAT scans, and other images for a living. We've all seen the motorcycle crash videos on YouTube and other social media, but we rarely see the aftermath when the motorcycle rider is transported to the hospital. In this video, I want to show you what it looks like when you crash and you're not wearing a helmet. For those of you who have never looked at a CT scan, let me show you how we're going to be looking at it using Mr. Melonhead as an example. When you're looking at a person, you see their eyes, their nose, their mouth, but when you're getting a CT scan, you're laying on your back, so your head is positioned like this, and it moves through the scanner front to back. So the way the CT scan gets the images, it makes slices through the head like this. So when we're going to be looking at the CT scan, imagine we're looking at cross-section slices through the head. First, let me show you a diagram of the skull bones so you know what we'll be talking about. The main bones in the skull include the frontal bone here, the temporal bones here, the parietal bone, which is on the side, and the occipital bone, which is in the back. Now, let's take a look at the CT scan. When we're looking at the CT scan, we're looking at the bone windows, which are optimized for the evaluation of the skull. The bones should be smooth and contoured. There shouldn't be any jagged edges or step-offs because that means that there's a fracture. So as we scroll down, you can see everything around here is smooth, which is great. But as we get further down, you can see this area here, which is completely abnormal. You're seeing jagged bone, which is impacted downward towards the brain, which is quite dangerous. This area is the frontal bone, which we talked about in the diagram, and these air-filled spaces are the sinuses. So if you've ever had a sinus infection, you know the pressure you feel right here. So the patient, when they fell from their motorcycle, they fell on their right frontal bone, causing an impacted fracture. You can also see the small little foci of air in the soft tissues, which may have come from the sinuses or external to the patient. And then as we go towards the eyes, which are here, you can see more fractures surrounding the orbit. Especially here, you can see all these little lines, which is a comminuted fracture, which is multiple fracture lines. The danger here is that these fractures can affect the muscles of your eye, they can affect the optic nerve, they can cause swelling in your eye, so it's quite dangerous. As we go down through the sinuses, you can see fluid in the ethmoid air cells and the maxillary sinus, which are here. That's blood from the fracture. Now, let's take a look at the soft tissues. This window is optimized to look at the brain tissue. And you can see the brain here. You have your gray matter on the outside, your white matter inside. And as we scroll towards our fracture here, you can see that there's all this bright stuff overlying the right frontal lobe. That is not normal. You should not have blood inside the skull. So what happened is the fracture probably caused a little vessel to tear, and it's causing a fluid collection on the outside of the brain. The danger there is that can cause swelling, it can create mass effect, it can press your brain tissue, and the skull is a fixed cavity. So once there's a swelling, there's nowhere for that swelling to go. And that's why the head injuries on a motorcycle are some of the most dangerous, because there's very little way to relieve the pressure unless you remove the skull. So, in this patient, they have a fluid collection on the outside of the frontal lobe, but luckily, you don't see any more blood in the brain tissues. Once again, if we look through the sinuses, you can see that there's more bright blood within the sinuses, which was caused by that fracture. So this type of fracture will require surgery to the orbit, to the skull, and will require a lot of rehabilitation time. As you can see, crashing without a helmet can have severe repercussions, so for everyone watching, please ride safe. If you found this topic interesting, please let me know in the comments, and I'll be sure to post more videos like this. If you or anyone has been in an accident and has some radiology images that you want me to talk about, feel free to send me a message through email or Instagram, and I can talk about your crash in another video. Thanks again for watching.